Hello, and welcome to UF Health Wellness University. My name is Marsha Mott, and I work with UF Health. Today's webinar topic is Spine 101. We have a great session for you today, and we're going to be recording this webinar. I'll send a link in email to you after this webinar is available in case you want to share it with anybody or refer back to it for more information. We're also going to have a question and answer session at the end of today's webinar. If you look at the bottom of your screen, there's a little Q&A icon. All you need to do is click that button and you can type your question to us and I'll receive those questions and I'll read them at the end. And then we will have a chance to kind of find out what questions you guys have and any more information or see if we can clarify anything for you. I also want to let you know some exciting news. UF Health was ranked #1 hospital in the state of Florida by US News and World Report. We're pretty proud of that, so I wanted to let you guys know about that. And part of that success is due to the wonderful physicians and other staff that we have at the hospital. But one of those physicians we have with us today is going to be our speaker, is Dr. Sein from UF Health Orthopedics and Sports Medicine Institute. Dr. Sein, I'm going to let you take it from here, okay? Thank you.
All right. Thank you very much, Marcia. And thank you for having me here at the Wellness University. I've certainly had an opportunity to watch some of these recordings, and I've learned a lot from my colleagues about wellness. So I'm excited to be able to contribute. And thank you all for joining us virtually. In these difficult times, it's tough that we can't be together in person, but I'm excited that we can at least still hold these informational talks. And if there's any silver lining to come from sort of these tough times apart, hopefully we can focus on sort of our self-wellness and take care of ourselves and kind of focus on ourselves. So with that, I'm going to get started with our talk. So I'm going to share my screen now. And so today's talk is, I try to formulate these mainly as sort of a, similar to how we would do a medical student talk. I try to talk about the background, so the epidemiology of back issues. We're going to talk about the anatomy and physiology, so basically the form and function of the spine. And then we'll also get into pathology, so when things go wrong. And then hopefully at the very end, we can discuss a little bit on treatments and the importance of treatment. Sorry, I'm just gonna, sorry. And so we'll just focus on that form. I'd like to say I have no conflicts of interest to disclose. All right, let's start at the very beginning. What's the epidemiology? And let's chat a little bit about the anatomy. So back pain and issues that cause leg pain are very common. So sciatica, issues like that, those are probably the #1 or the #2 reason people go to see the doctor. And this was a study looking at patients that presented to the Mayo Clinic, and really people go for rashes and then they go for arthritis, but a lot of issues come down to the back. So it's very common. So if you have a back issue, don't feel like you're alone. In terms of risk of getting what we call radiculopathy, which is the medical term for sciatica or a pinched nerve in the back causing pain down the leg, it's about 40% of everybody will get that. So nearly half of us will suffer from sciatica at least once in our lives. And it happens equally to men and women. So it doesn't follow any specific gender pattern. And we like to think of back pain as sort of an activity related issue, right? You shouldn't do things that will hurt your back. Examples, don't do heavy lifting. And more, we're starting to realize that a lot of these back issues are probably more genetically predisposed than anything. Again, we would think that maybe men would have more back pain than women because they tend to have careers more in labor, but that doesn't bear out in our studies. And in Denmark, where they do really good registries of their twins. So they'll keep registries of their identical twins, or what we call monozygotic twins, or MZ here. And they'll keep registries of their dizygotic twins. And if you ask them to kind of look back at their lives, what kind of life they lived, was it a very heavy physical life, or was it, more sedentary life? And when you really teased apart identical twins, so people who have the same genetics, they tend to get the same amounts of back pain, no matter what kind of physical activities they did. That's less so in dizygotic twins. So that's kind of the same thing as brothers and sisters. There's still a correlation, but it's not the same as if you shared the same exact genetic information. So what we take from these studies is that genetics does play a big component to these back issues. So it's not just what you do, it is a little bit about mom and dad. All right, so what about the anatomy? What causes pain in the spine? And I like to break it down into sort of just a few main areas. We have the joints, we have the cartilage, or what we oftentimes call the intervertebral disc, or just disc for short. We have the nerves, and then what's not shown on this diagram is all the muscles that connect to these bones and these nerves and the ligaments in between. So this is a view of the lumbar spine from the side. So this would be where the stomach would be on this side, and this is kind of the tailbone or the tushy area right here. The vertebrae are the bones of the spine, and they stack upon each other like stacking blocks. And in between the vertebrae is where the disc lives, and that acts as almost like a cushion supporting the vertebrae. And then in the very back are these joints, and that's where the vertebrae meet, and that's where they meet and communicate with each other. You can think of these joints similar to the joints of like our knuckles. They have that same sort of similar properties in that they are fully synovial joints, so they're true joints. And this is a view from behind at those joints. So we have a pair of them, one on each side, and the nerves as they exit out of the canal. And at each level, the nerves go off to innervate the leg. So they exit out at each of these roots, and they take a pathway down the leg or down into the arm if we're talking about the neck. So as I was saying, the facet joints are where the vertebrae interact with each other. And because of that, this is also where we get wear and tear. So we get arthritis here. So over time, the cartilage of these joints, these synovial joints, will get wear and tear. And for some people, that happens sooner. That can be related to autoimmune diseases that can kind of predispose you to getting earlier inflammation in the joints. Or if you have a condition called scoliosis, where there's a curvature to the spine, sometimes that can lead to uneven forces on these joints. So you get a little bit more pressure on one side, a little less pressure on the other, and you get earlier sort of arthritic pain. And the pain from these joints is usually pretty reproducible. It's very common that joints like movement. So when joints have arthritic pain, they tend to get painful when they haven't been moving. So a lot of people with what we call lumbar facet joint pain or joint pain, arthritis pain in the spine, they'll present with stiffness in the morning time. Because overnight you haven't been moving, those joints get very stiff. And when you first get out of bed, it's usually the worst time. And then as you start moving, those joints tend to rehydrate. They get better circulation and they loosen up. So that's the kind of pain that tends to get better after you had your morning shower, you've been able to kind of stretch out a little bit and get downstairs. But if you've been sitting for a long time, you haven't been moving again, those joints, they tend to get tight again and that will recur. So that's a common pattern for what we call facet joint pain, is this morning stiffness and then a gelling, meaning as you've been sitting for too long or if you've been in one place for too long, those joints just stiffen up again. The intervertebral disc, or that piece of cartilage that sits between the vertebrae, that can also cause pain, and it can also cause a pinched nerve. So if we were to look back at our diagram here, and I were to take a little bit of a cross section right through this disc, so I'm just going to take a slice right through here, and we want to take a picture of that. That's what this is going to. That's what this is going to look like. So this is the front of the disc, and this is the back. The disc looks sort of like it's sort of built like a jelly bean, or like the sole of a sneaker. It's got a really rubbery outer shell, and then inside's a little bit of a gel. And so that combination lets it be sort of act like a shock absorber. It's compressible and it can expand, but it also has tensile force to keep it intact. But again, like I said, these discs, these pieces of cartilage, they can wear down, and in all of us they wear down, but some of us sooner rather than later. And if the inner gel can kind of push out too much, it can end up irritating that little nerve that exits out right behind it. And that will lead to lumbar radiculopathy, or commonly called sciatica. There are some things that we've studied that can cause increased pressure on the disc, and we sort of think that might lead to earlier sort of wear and tear on these intervertebral discs. So there was a study done looking at what is the pressure inside the disc, and what are certain positions that increase or decrease the pressure. So the lowest pressure on the disc is when we're laying flat on our back. And that goes up as we stand, if we bend forward, if we're holding something when we're bending forward, but also if we're sitting. So sitting at a chair is similar to standing bent forward in terms of pressures on those discs. And one of the toughest things we do is sitting and leaning forward. That really puts a lot of pressure on the disc. And this is sort of why I think a lot of people get back issues if they do spend a lot of time at a desk. We oftentimes will have this posture of sitting with our back, our lumbar spine against the back of the chair, but leaning forward. And that just puts a lot of pressure on these discs. So when the discs change shape, as we were saying, they can pinch a nerve. And when that nerve gets pinched, it sends pain or tingling or numbness down the distribution of that nerve. And each of the nerves tends to track a different location of the body. One of the most common nerves to get pinched in the spine is what we call the S1 nerve. So it's this lowest down nerve here. It's this first pink line, basically. That's the S1 nerve. And that distribution is just straight down the back of the leg. So that's why oftentimes we think of sciatica as this pain in the back of the leg. But really the issue is coming from the lumbar spine. The nerves getting pinched way up in the lumbar spine and then causing pain in the buttock all the way down to the foot. Muscles can also cause pain. And I see this a lot in, again, people who sit at a desk commonly. People have a lot of muscle tension. That can be in the low back, also in the upper back and neck. We tend to carry tension there and also stress there. So as it's been a pretty stressful time lately, I've been seeing a lot more people for this kind of condition as well. And there are certain muscles in the back and in the buttock. There's one in particular called the Piriformis muscle. And that's this one over here. And when we think that these muscles, if they get too tense, you can get these muscle knots that can cause pain. And we call those trigger points. And so muscle tension can definitely also be a big trigger for pain. All right, so far the talk has been rather depressing, I know. So it's talking about the fact that some of this is just genetics and it's out of your hands. And you can blame your mom and dad for this sort of thing. And I've also talked about all the things that can go wrong and how, time is just kind of leads to a lot of this normal wear and tear. So what can we do to kind of prevent things from getting worse? What can we do to fight genetics, the genetics that we've been dealt. Well, first of all, we have looked at certain things that can be controllable somewhat and can sort of be adjusted and lead to better back pain outcomes. So first of all, as BMI increases, or as body mass increases, meaning as the percentage of fat to our height increases, or waist circumference to our height basically increases, so does our back pain. I think some of this is more of a secondary marker. As our BMI goes up, we're probably less active. Some of it's more direct from the just biomechanical forces of increased weight pulling on these vertebrae, and also pulling in different angles, and maybe leading to more of a pull in the stomach region. So keeping a healthy weight is one of the first things we can do to reduce our back pain incidence. I don't know if you've heard the news, but smoking is also bad for you. Basically, what smoking does is it sort of restricts blood flow in very small blood vessels. And so what happens to the vertebrae and the disc is they get sort of starved of nutrients. This is sort of a cross section of a vertebrae, like we were looking at before, and then the disc is right above it. So on the healthy side, you can see sort of just a normal architecture, nice sort of solid lines, which shows that the bone is healthy. Whereas in a smoker, you kind of starve the nutrients out of the vertebrae and the disc, so you get early loss of the fluid in the disc, and you lead to sort of a loss of strength in the bone, so it kind of collapses almost like a Coke can getting squished down. So if you smoke, one of the best things you can do for your back is quitting smoking. It's almost like, if you can think of it almost like a plant. If you take a plant and you give it enough nutrients and sunlight, it flourishes, does well. But smoking is basically the equivalent of taking away sunlight from a plant. It's like taking that plant, putting it in a corner, and just starving all those cells of all the nutrients they need. Biomechanics can also play a role. You've probably already heard about, text neck or cell phone neck. This idea that as you're looking down or staring down at your phone, you're putting more strain on your neck. There's definitely a mechanical issue there. So when you're in a neutral spine, meaning you're basically centered over your pelvis, there's less of a pull on these muscles, all these back muscles that try to keep your head up. And as your chin goes forward, you're basically creating more of a fulcrum here, and that creates more strain on these muscles. All these muscles that try to keep that head up are working even stronger, or working even harder, because basically the weight of the head is heavier as you move it forward. This is called a kyphosis. And so, we could talk about a thoracic kyphosis where there's a curvature forward. I did receive a question about kyphosis, and that we'll address in detail later, but just want to talk about it now while we have a chance, because I think that that questioner was kind enough to watch my last webinar, and I guess I missed it, so they stuck around for the second one. But in kyphosis, really, these erector spinae muscles might not be as strong as we want them to be, so we'd want to strengthen those erector spinae muscles up to sort of deal with that kyphosis, and we'll talk more about that later. So again, keeping a neutral spine can be helpful in reducing some of the stresses on the muscles and ligaments and joints. Same is true as in the lumbar spine. This is what we call a lordosis, where there's an excessive curvature to the lumbar spine. And this is that cervical kyphosis, where there's that curvature there. And a nice neutral spine. You could draw a line pretty much from the earlobe down into the side of the hips, into the ankles. Practicing healthy biomechanics for the discs as well. As we talked about earlier, when you're sitting, you're actually putting a little bit more pressure on the disc than when you're standing. So I do tend to recommend people try a standing desk, or at least a height adjustable desk. It's not perfect. It doesn't reduce all of the stresses on your lower back, but it certainly improves things. And not just for the lower back, I also think for the upper back, it keeps you in sort of a better upright posture, as opposed to, when you sit, you do tend to have that forward flexion and lean forward in your chair. But when you stand, it can kind of help remind you to keep that nice upright posture instead. We've done studies on the discs, and this is just showing how much more force you add to the disc if you try to lift something up using quote unquote your back. So I think you've probably heard, lift with your legs, not with your back. And we actually did studies to see what are the pressures and what are the differences in pressures. And it's sort of twofold in terms of what the disc feels if you do stooped bending versus squat bending. And so if you bend at the knees and then lift, the forces versus bending at the hips is about 2/3 to a half, depending on the weight. That's why practicing very good lifting techniques is important. And it's amazing. I don't think we could do this study nowadays with, I'm sure this is a med student, I'm almost positive, having his disc pressures measured. And so, yes, again, lifting sort of with your legs, bending at the knees to lift as opposed to bending at the back reduces the kilogram forces exerting onto the disc. And then in terms of exercise, I speak very generally, typically, in terms of exercise programs, because I think that part of it has to be something you want to do and are willing to do and brings you some element of joy and interest outside of just the benefits to your back and spine. As far as studies going, there have been large meta-analyses looking at yoga, and they've shown improvements in pain with yoga. And a lot of these large studies do not show any increased incidence of injury. And that's one of the things I hear often amongst my patients and even amongst my colleagues. I hear my patients say, "Oh, my doctor told me not to do yoga because it'll hurt my back." I think we have to be cautious, certainly with any exercise. But if yoga is done properly and if you know your limits, it can be done safely. And the studies don't show that it causes any increases in back pain. Certainly, I think we can think of anecdotal stories of people getting hurt doing a stretch too much, this or that. But again, as I said earlier, a lot of these back issues are sort of more genetic than anything. So some of these things are going to happen irrespective of what we do. But I do find that things where you are strengthening your core muscles, meaning your abdominal muscles, your low back muscles, the erector spinae muscles, all those small muscles that stabilize the spine, that can go a long way in reducing back discomfort. There's also been randomized studies looking at Pilates and specifically in people with chronic lower back pain. And it too has shown improvement. And I think, again, for similar reasons of strengthening those core muscles. So that was sort of a whirlwind talk. And I know that it's a very kind of 10,000 square foot view about the spine and sort of how things normally work and when things can go wrong, and general tips on what we tend to suggest to keep things better. I find that oftentimes people enjoy the question and answer section more than the actual presentation. So I'm going to pass it over to Marcia to take care of that now.
All right, thank you. That was a great talk. We have had a few questions that came in. So the first question that we received, and we actually received this one in advance, is I'd like to know if there's some specific muscle exercises I could do to strengthen my back if I have, and then also, is there any specific ones? And also, if I have pain in my back, should I use ice or heat?
Yeah, in terms of specific exercises, again, I do tend to recommend exercises that focus on the core musculature. So a lot of the muscles that are connecting to the lumbar spine and the abdominal musculature. Sort of simple examples of that would be exercises where you do a bridge or a plank. A bridge would be if you're laying flat on your back and you lift your back up, so you're in line with your knees. It's very hard to explain these, but basically you try to turn yourself into like a figure triangle on the ground, or vice versa. A plank is just with you sort of um, facing down on the ground and almost in a push-up position, or on your elbows, just sort of holding a neutral, straight lumbar spine. Those are just general good exercises for strengthening those really deep core muscles of the spine. And I remember somebody asking me about specific exercises for kyphosis that I should talk about. I think this is an avid runner. I do like a lot of the postural exercises for issues like kyphosis and scoliosis, things like yoga, but in particular things like Tai Chi. A lot of those exercises are to strengthen those erector spinae muscles, those muscles of the spine that kind of go up and keep us up and straight. And a lot of the poses in Tai Chi can help kind of keep that spine as erect as we can. And one of the examples I use is pretending like you have a string at the top of your head, just trying to pulling you up, trying to make you about an inch taller. And that can help remind you to sort of keep those upper back and neck muscles engaged, to sort of help bring that posture back up. And
Okay.
then regarding, and then you said the ice and heat thing. So they have done studies, actually, as you can imagine, large studies looking at ice and heat. Basically depends, is all I can say. In general, we think of ice as an anti-inflammatory treatment. And so if you feel like that area is really warm or inflamed, ice can help cool it down. Whereas heat, I tend to recommend more for muscle tightness. So if there's muscle spasm or muscle tightness, sometimes heat can help ease that muscle tension. But a little bit of it is trial and error. So for some people, they'll like to start with some heat before an exercise or before some therapy, and then use some ice at the end to cool off if they've maybe feel like they've inflamed their back or inflamed some of their muscles or joints.
Okay, we have a question from, sounds kind of like a home health agency that does some work with seniors. And they want to know, what are some of the common problems you see with seniors specifically, and maybe something simple that seniors or their caregivers to help them decrease back pain, especially if they're bedridden or in a wheelchair?
Oh, that's a great question. Yeah, I think certainly from immobility, we do get a lot of back and joint issues, particularly of those little knuckle-like joints, what we call the facet joints in the back. And some of the best things to do is like I said, joints like movement. So as much as you can, get in some movement, even if that's as simple as getting out of the chair and standing at the counter for some time. Um, if there's access to water, certainly even just in like a warm tub or in a pool, getting movement in that fashion can be helpful. Just at home, I do find that just the very simple task of every day getting out of the chair and slowly building more movement in, whether that's maybe a few steps, maybe it's just a few moments standing. Every little bit can be helpful because again, those joints, they really like motion. That motion helps them get lubricated, get good blood flow and circulation. So if you can work that to the day, that's ideal.
Okay, good question there. Another one, is there any evidence that glucosamine, chondroitin, or collagen is useful for the spine?
I do get a lot of questions about supplements. There's, the largest study looking at glucosamine and chondroitin looked at it for the knee. And I don't know if we have very good data looking at the spine specifically, but from that study, it seemed like certain people with severe arthritis do benefit from the use of glucosamine chondroitin, but the average person doesn't. So what I tend to say is, if you want to try that for a month to see if it'll help with your arthritis pain, I think it's not unreasonable. But if it doesn't help after that, I usually say it's you're probably just not in the group of people that do tend to respond to it. As far as other supplements, there's been some evidence that turmeric has some anti-inflammatory effects. I think that of the supplements tends to have the most data behind it, but even still, not a ton.
Okay. Another question. What are your thoughts on doing moderately heavyweight lifting, specifically deadlifts and squats? Use a good form, of course.
Yeah, well, so first I say, like I was saying earlier, I think with any exercise program, it's got to work for you. So I don't tend to tell people, oh, don't ever do that exercise. If that's what you love to do, I think we kind of have to figure out how you can do that, understanding that there are risks, et cetera. Moderate weightlifting is good for the bones, particularly for postmenopausal women. I like it to really keep bone mineralization. So moderate weightlifting is good. Regards to deadlift specific moves, deadlifts, etc. Again, like I was saying, with those studies looking at the most pressure you put on a disc is when you're bending and lifting. So ideal form is good, but I just know that you are putting a little bit more pressure on those discs. If you're somebody that is prone to getting disc issues like a disc herniation, I might say that deadlifts are not the best form of weightlifting for you, and there might be some other exercises that we could figure out for you. So broadly speaking, in general, I'm a proponent of weightlifting with some certain caveats, if that helps.
Okay. Yeah. Another great question. What can you do for bulging discs from a car accident? They didn't specify how long ago it was, so.
Yeah, this is a common question I have, and it's a good question to ask because I first say that there's nothing you need to do about bulging discs. Um, Bulging discs is just a finding we see on MRIs, and it can be a finding that we see in people that don't have any pain. So just because the discs are bulged doesn't mean that they are an issue. And um, oftentimes they don't need to be treated. Now, if the disc bulges enough to irritate the nerve, as we're shown in those pictures where that disc has changed enough of its shape to press on the nerve, and there's different treatments we can do, and it varies either from simple treatments with exercises like physical therapy or treatments with an injection. And on very, very rare occasions, some people do need surgery. But again, speaking in broad terms, bulging discs in and of themselves are not something that necessarily need to be treated.
Okay. Could you please address fibromyalgia and back pain?
Um, yeah, that's sort of a webinar in and of itself, I guess. In general, I think fibromyalgia tends to be more on that same spectrum as we're talking about the muscles causing a fair amount of the pain, and you get these hyper irritable foci of muscle tightness and muscle knots, which is sort of on this whole spectrum of what we call myofascial pain with fibromyalgia. It can be difficult to treat, but I find that physical treatments tend to work best. And that includes physical therapy, exercises, and so forth. I should put out another disclaimer for this talk. It's hard to get into specific treatments for specific individuals just because it can be so varied. And we do try to tailor our treatment program and our treatment plans for the individual, and I think that has to be important because, again, what one person enjoys is not what another person enjoys, and what an exercise program that will work for one person might not work for the other, and so there can be sort of variations in what we do, but in broad strokes, I tend to focus more on physical treatments for that.
Okay. Does walking help or hurt the back pain?
Typically helps. Yeah, we do recommend movement. I think walking in general has good uh, benefits for our health and well-being. So yeah, walking helps back pain in general.
Okay. Another person, this is more a question for me really, if someone asks, is the recording going to be made available? Yes, it is. I'll send an email out As soon as I can get it transcribed, which takes me a couple days, I'm hoping to get it done today, so I'll do my best. But we'll get that out to you pretty shortly, because sometimes people like to watch it again and go back and refer to something, or sometimes they wanted someone else to hear it now because they know that they were having problems. And so, yeah, it'll be sent out by email, as well as we post it on our website, ufhealth.org, and then /wellness. So ufhealth.org/wellness. And then we have another question after that. Is there any one particular type of pain relief you recommend? They didn't really ask, give any further details.
Oh, that's a great question, because the simple answer is no. I do find that we tailor our recommendations to the person. I tend to be a less is more kind of doctor. I start with the simplest, least invasive, most natural treatments first, for relieving pain, and then go from there. So typically we try to do the least that we have to do in terms of medications, interventions, injections. So I think less is more is my general answer to that.
Okay. Another question. Can you talk about what happens with degenerative discs? What happens when all the fluid leaks out? Is that going to require surgical intervention?
Great question as well. This webinar is wonderful. I should just do a talk show about this every week. So the discs lose hydration in all of us, and so the term degenerative disc disease is a very archaic term, and we're trying to move away from it because it's not very helpful and it's not accurate. If you get gray hair, that's not degenerative hair disease. You know, that's natural aging. And the discs we know will lose shape, they'll change shape, they'll lose hydration in all of us. In most of us, that won't cause an issue. In select few, it might cause an issue. But in and of themselves, changes to the discs, they're not a disease. I think that part of that's just we have old terminology in medicine, and it takes time for us to update that terminology. And so a lot of these terms get perpetuated. But I would think of disc changes as, you know, normal aging and not a disease, just like hair going gray. It happens to all of us, or most of us, I should say.
Yeah. 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 Let's see. Is there any specific thing you could do to prevent a disc bulging out? I feel like you've kind of answered that a little bit, but
A little bit. I guess I would just get in touch on the fact that some of this is genetics, in terms of, you know, our there's a little bit of encoding into us in terms of if we get wear and tear in these discs. Certain things put more pressure on the disc. As far as anything that really puts the most pressure on the disc, I would say don't become a paratrooper or take up skydiving. That tends to be the one thing that really definitely can increase your risk of a disc herniation. But sure of that, not really.
okay. Here's a question from someone in Jacksonville who's watching. I've been told I likely need neck surgery. I'm going to go back to see the neurosurgery team in about 10 days. I always like to get a second opinion. Does your team do neck surgery, and can you do second opinions?
I believe we can provide a second opinion. I myself am not a surgeon, but we certainly have very good neurosurgeons here, in Gainesville. And as far as their second opinions, I don't see an issue why they wouldn't be able to provide that. And I agree with getting a second opinion. I would do so myself.
Okay, I can, the second opinion person, I'll send them some information privately and let them know how to get that, because we can do that, and usually we can get them in pretty quickly. So another question from someone. I believe Dr. Kumar and maybe others are performing some types of minimally invasive surgery at UF Health. What types of lumbar spine surgery for stenosis can be done that's minimally invasive? Like what can be done and what cannot be done, basically in a minimally invasive way?
I think those are trade secrets, and I can't give away. No, just kidding. There's certain things they do to decompress the ligaments of the spine, and so they'll remove certain tissues that can be pressing on the nerves. I think maybe we'll have to have Dr. Kumar give a webinar on that topic, though.
Sounds good. Sounds good. Is there a specific exercise that you recommend for stiffness in the neck or lower back due to bicycle riding? We usually ride about 20 miles at a time.
Oh, yes, then definitely you should be doing some back extension exercises because that if you're especially for a road cycle, you're in a very, very flexed posture. So again, getting those erector spinae up and strengthened. So things like yoga, like upward dog poses, those sort of stretches where you really, or even a cobra pose. If you haven't picked up, I'm a big proponent of yoga. So that's usually my answer for everything.
I like yoga too. I need to get doing it more a little bit, but
We'll get
here's
you there, Marcia. We'll get you there.
here's another question that is kind of related. Does acupressure treatments, do they help or are they ever recommended?
I feel they can be helpful. Now, a lot of this is more my own anecdotal stuff when we get into some of these treatments for muscle knots and muscle pain. It's not that well studied, but I do think that acupressure can help for muscle-related pain. So that slide we had where you get those really tight, hyper-focused areas of muscle tightness, that's where I would say something like acupressure can be beneficial.
Okay, here's kind of another pain question related to that. Do epidurals work for treating lower back pain?
Oh, yes and no. So it depends on what we're treating and why. So again, you have to tailor it to the person. They can be useful as a tool, I'd say. And the idea would be if you're in a lot of pain and you can't do any physical therapy because it's just so uncomfortable, sometimes that epidural is a much needed step as a bridge to get in there. I wouldn't view them as a cure, and that's my honest opinion of them. They're not something that's going to take away all the pain and fix everything. But for certain situations, they can be a useful tool to get you where you need to go.
Okay. How do you feel about stretching on a board that's like a bridge or inverted but only slightly? Almost as a substitute for the old inversion technique that used to be done. So,
I see. Well, I don't imagine there's much in the way of harm from that kind of stretch. I will say in general, the inversion tables and the sort of the gravity tables where you kind of put your feet up above your head, they don't tend to really lead to very prolonged improvements. You can imagine how they might feel good short term, but being upside down for half an hour out of your day while being upright for the other 10 hours, I don't think they'll lead to much long-term improvement, but I'm not opposed to trying stretches and different things like that.
okay. Is walking a recommended treatment or will it help sciatica?
Um, so walking is good in general for the low back, and as much as you can walk is better. What we've found is that for back issues, sitting and staying in bed is probably the worst thing you can do because that leads to weakness. And so it's tough because we're trying to get muscles stronger and being in pain with walking it makes it tougher. But yeah, I think we try to make that part of our physical therapy program, keeping you mobile. And that might be a situation where something like an injection or a medicine might be useful to kind of get you over the hump there.
Okay. Someone said, first of all, great presentation, but they want to know what the difference in terms of a ruptured, slipped, herniated, or bulging disc. Are they all the same thing, or each one of those a different
Mhm.
illness?
Yeah, I could draw like a giant Venn diagram with different circles of what is what falls into what category. But in general, herniation means something's in the wrong place. So you can get an umbilical hernia. So that's when there's a hernia in your belly button. So a herniated disc is when the disc isn't where we would typically see it. And then from there, there's gradations of how much it's not in the right place, whether it's bulging, slipped. That gets into kind of more of the jargon that we use, but I guess umbrella term is disc not in the right place is a herniation. And then from there, we have different terms for the shape and the more what we call morphology of the disc.
Okay, that's a good question. If you have lower back pain after you're sitting in a recliner, almost like an electric feeling in an area, can you kind of address what might be going on or what I should do or how I go forward with that?
Yeah, well, the electrical field definitely sounds like maybe some nerve irritation, just that kind of character of it or that adjective. Um, and again, we have you come in, we do a little physical exam, make sure that it's nothing that we'd be too worried about, and then most likely we would be starting you on simple, straightforward physical therapy treatments as a beginning step. Um, Again, I'm a pretty conservative doctor, so I like to try all the simple stuff first, and then we go from there.
All right. Here's another question about an inversion chair. Is an inversion chair helpful where you get turned upside down?
Yeah, I'd say in general, again, no good data to put our hat on for an inversion chair, table, anything where you're spending a little bit of time upside down. I just think that for that time it might feel good if you can tolerate it. It's a lot of blood rushing to your head, but a lot of the effects of it are kind of undone once you're upright again. So I'd say I'd much rather you sort of strengthen all those muscles and and neck muscles, back muscles to deal with gravity because that's the world we live in. But for just for comfort, if you wanted to, hang upside down for a bit, I don't think there's much downside to it. For long-term treatment solution, I'm not a proponent.
Okay. We have another question that says, I have a neck injury and I was told there was a procedure where they could scrape away some of the buildup that's causing the arthritic condition. Is this procedure possible with the neck vertebrae?
Hmm. So I guess I'm having trouble making sure I understand what they were kind of describing to the patient. Uh, there's various operations that can be done um, to augment the vertebrae and to create more room for the nerves. So I'm just not sure exactly in terms of the terminology with the scraping, et cetera. But um, broadly speaking, there are operations that are utilized to try to um, augment the vertebrae to create more space.
Okay. Is there ever a chance that a study will be done with people volunteering to be in the study about spine and spine pain?
Oh, that's a great question. And yes, we are doing lots of research here at the university on spine and spine pain. And so anybody interested, we would love to get your information. Me in particular, I'm interested in looking at novel ways we can image the spine. So special new MRI techniques that can better diagnose back issues. And more broadly speaking, I'd like to do more work in looking at novel ways of doing therapy too, for the spine. Things like horticultural therapy. So figuring out ways that we can get people in the garden and working on their spine and exercising. And at UF, we were really lucky to have a really great collaborative team in these kind of more sort of fringe or edgy sort of treatments and novel therapeutics. So there's definitely research going on every day here at UF, and we'd love to have you as part of it.
Okay. Yeah, I know you could go on our website, ufhealth.org, and search clinical trials. And there's a list of all ongoing clinical trials that are there. You have to kind of know what you're looking for because there's a lot of them. But
Yes, ma'am.
yeah, that's a good resource for that. Also, clinicaltrials.gov, but that's nationwide. So it would still get you back here, but just
Hmm.
point that out. And then
And
yeah.
certainly my office, if you call the SPNE number that we have listed, that certainly we can help get you in touch with our research coordinators.
Okay. Yeah. Um, Also, let's see. Do you have any advice from someone who is starting to experience increased back pain from scoliosis?
Yeah, so there are certain therapeutic techniques for scoliosis, and there's one physical therapy program called Schroth, SCHROTH. It's a very specialized program. It's a bit intensive, but that has been shown to help with certain aspects of scoliosis pain and with breathing techniques. Again, I hate to sound like a broken record. I do like the postural exercises like yoga and Tai Chi. I think those are just general ways of kind of keeping those muscles of the back strong and pulling at the right angles.
Okay. If you have persistent sciatica, 8 months or so, should you have an MRI?
Yeah, it's tough to get into these kind of specific management questions, and I should have put a disclaimer that each case is sort of different. There's reasons to say yes and reasons to say no to answer that question.
I think that's a good answer.
As vaguely as I can.
Yeah, I mean, it depends, I think, on a lot of factors, though. So, are you doing any work on stem cell therapy for back issues, either you or anybody over at UF Health or the UF Health Spine Center?
Yes, myself and my colleagues, we were looking at regenerative therapeutics, different treatments using your own blood, and potentially even what we call mesenchymal stem cells. So cells derived from fat tissue or blood, basically, that can be potentially regenerative. Now, this, of course, is in its very, very infantile research stage, but that's the work we are trying to push forward.
Interesting. Okay, that's great news. Here's another question about a product maybe that people might see out on the market there. What's your opinion about devices that cradle the neck to stretch the neck and upper spine? A device that connects to a doorknob. Is that kind of a gimmick or is that beneficial?
Yeah, it sounds almost like one of these Rube Goldberg kind of contraptions. I think again, similar to the inversion tables, the stretching, it can feel good. But again, I just don't know how reasonable it is as like a long-term treatment solution. If you're going to stretch your neck out every night, I suppose, it can maybe feel comfortable, but I don't know how much long-term benefit it would really give.
Okay. And here's an interesting question. What's your opinion of chiropractic treatment?
Yeah, so I do worry about chiropractic treatment in the neck only because there are some blood vessels that are vulnerable. And so while it's very rare for there to be an issue with neck manipulation, it can happen and it can be pretty bad. So I don't tend to favor chiropractic care in the cervical spine. But in the lumbar spine, I'm okay with it. And I view it similar to other symptom management techniques. So if your back is really hurting and you want to, try to get your lower back feeling better, either with a massage or a chiropractic manipulation, I think that's reasonable. What I do worry about is I don't think everybody needs to be symmetric, and so I do worry when you go to a chiropractor and they get all these X-rays and they tell you you're all out of alignment. You need to come in 3 times a week to get back into alignment. That seems a bit excessive to me. But if you do want to just utilize chiropractic manipulation on occasion for symptom control in the lower back, I think that's not unreasonable.
Okay, thank you. Here's a really good question. What one suggestion would you give to us to prevent spine pain or degeneration? And what one suggestion would you give to us to help protect or things to avoid to do to help our backs?
Oh, wow. The one thing would be stay active. And one thing not to do is don't smoke. Easy as that.
Okay, that's easier than I thought. I'm like, sum up all the solutions in 2 things. Yeah. Someone asked the question about spondylolisthesis. Can you describe the pathology of that? I have it, as did my father. So, is there a genetic component there?
Can you repeat the term one more time? Yeah.
Spondylosis. Am I saying that right?
I might have to phone a friend. If it's spondylosis.
Maybe I'm saying it wrong. SPON. Dyloli.
Yes,
Okay.
I've got it. I've got you.
Fine.
Yeah, so that spondylosis is kind of a general catch-all term we have for sort of wear and tear. And some of that is genetics. We will get wear and tear from life, but also mom and dad. And keeping those muscles strong in the spine is sort of the best way to kind of reduce that spondylosis, that wear and tear. I think that the more stability we have, the better. If you think about when there's movement, if things are sort of loose, that's when there tends to be an issue with the cartilage getting excessive wear and tear. The example I use is like a loose screw on a bike. You might hear it kind of like rattling as you're riding. And then if it kind of rattles too much long over time, it can just wear right off. And that's why you want to create stability. You want less of that kind of movement so there's less wear and tear. So a lot of core strengthening exercises, working on posture, working on stability. And while we can't change our genetics, we can't pick our moms and dads better than we do. We can work on our muscles and our strength to create that stability, which maybe wasn't there from mom and dad.
Okay. Well, do you think that stem cell therapy will help disc problems?
One day, yes. One day, yes. I think we will have a treatment that I think in general, I think nature's got a better way of treating these these wear and tear issues than what we have right now. So I am hopeful that one day, yes.
Okay. What do you think of golf? Is it harmful or a good form of exercise?
I like golf because it keeps the lights on here. Well, I view it as anything, with exercise. I think if it's something that you enjoy and it's your passion and it keeps you active, we have to figure out a way to keep you going. There's certain things about golf, that twisting motion, that can lead to certain issues with the facet joints, but we have treatments for that. So if golf is your passion, if that's your exercise passion, it keeps you with some cardiovascular fitness, then more power to you, and um, will help keep you on the golf course.
Here's here's a question about osteoporosis. Do you treat that? I don't have any pain or any problems, but I was diagnosed through a DEXA scan. I take Prolia, but the hips have gotten worse and the spine has gotten better since my scan 2 years ago.
Yeah, I would have to have you see one of my really great colleagues in endocrinology who can really manage some of the bone metabolism issues really well.
Okay. Is there a way to rehydrate a disc or repair a disc from long-term smoking in addition to giving up smoking?
Not that we know of just yet. And I think that hopefully one day we will have sort of more regenerative treatments. But as it is now, if you can stop smoking now, that's the best thing. And allow those discs that are there to start getting those nutrients that they've been kind of starved for. So while we might not be able to undo some of those changes, we can certainly improve upon what's going on now.
Okay. There are several different types of yoga. Is there a certain one that you recommend for beginners that's beneficial for back issues, or a certain website or video? Because, most of us are doing things online or at home now.
Yeah. I think a good place to start, especially during this whole lockdown time, is there's Yoga with Adriene, which is a YouTube channel, I guess, and it's sort of just a very good basic intro to yoga. Um, Depending on your abilities, I think the very basics, what we call sun salutations in yoga, or your vinyasas, are a good place to start. Now, it's not for everybody, and even if you're super inflexible, you might want to start with something more basic like chair yoga. So everything is just done in a chair, and so it's not it's a little bit dependent on where you find yourself, but as a rule of thumb, I tend to recommend for the average person very basic sun salutations. It's just a good way to start your day, and it works on your core muscles as well as some mindfulness too. It gives you a chance just to kind of clear your mind, focus on your own wellness, which can have a profound effect on your muscle tension and your muscle pain too.
Okay. I just want to follow up on that because I know I was trying to write that website down too. Did you say Adrian Yoga?
Yeah, it's a YouTube channel, and I think it's
Okay.
Yoga with Adrienne, Adrienne, I believe.
Okay. And then, kind of what you also described also sounds a lot like what Dr. Astores talks about in our integrative medicine program as well. And she's going to be speaking in a couple months from now as well. So the integrative medicine, I know she's a big proponent of yoga and Tai Chi and a lot of other things as well. So one of the questions that someone also asked is, are your clinical trials listed on Research Match? And I have researched that answer, and yes, they are. So I wasn't sure if you knew that because I'd never heard of that, but I phoned a friend, and so we got that taken care of. And also the follow-up on the person who had I have some arthritis in my neck, and I kind of wanted it scraped away, basically. They said, here's their response to that. Concerning the scraping away of excess calcium, is this applicable to the neck? Because I was told that the fusing was the only thing possible on the neck. So it sounds like they're asking, do I have to have a fusion, or can you just like trim away some of the bone?
Yeah, I'd have to defer to one of my colleagues, and also I think, that's the kind of question that we really need to require, an in-depth, view of you and your pictures, and hard to give any really good advice just over the webinar. Um, I'd say that that's definitely a difficult decision, but maybe a good one to come in and get a second opinion with us for.
Okay, here's a really interesting question. Are there any specific foods or diets that help the back, like maybe an anti-inflammatory diet?
Yeah, different for different people. I think if you tend to be somebody who gets a lot of joint inflammation in general, so someone that's more has like systemic joint issues, that can be a sign of a dietary issue. And so in those situations, sometimes we do try to do low inflammatory diets. One caveat to them is that they can be pretty restrictive. The one that really jumps out is avoiding nightshade vegetables. So and there's various, but there has been some studies showing that those vegetables tend to be more pro-inflammatory, and that for certain individuals cutting them out can be helpful. But I would just put the big caveat that it can be really, really tough.
Okay, I'd heard about the nightshade diet and was kind of curious about
Yeah,
that too. So that's some good information to hear. I mean, it's it's an easy non-medication way to maybe see if you can get a little bit of relief.
right. Yeah, and that might be the time to consider it. Is if the alternative is to maybe try medicine every day, then yeah, maybe I would cut out all the nightshade vegetables first.
Yeah. All right. Well, that's all the questions that we have right now. So I really want to thank you for taking time out of your very busy schedule and talking to us from your office or wherever you're at right now, and everybody watching from home. And as we leave today, I'm going to put up a slide if you need to schedule an appointment or want to know more about